Hi, Claudia. Good to see you. We're going to be performing a hand exam. This is going to involve me checking the surface of the hands, testing things like strength and the nerves of the hand and how everything's functioning. Is that going to be all right?
Yes.
During this exam, I will have to touch you and manipulate your hands. Is that okay?
Yes.
Okay. And are you currently in any pain right now?
No.
Okay. I'm going to ask a little bit about your hand health history. First, starting more surface level and then going in deeper. So I do see there's a bit of dry skin. That is normal for you, or is that?
Usually normal.
Yeah, I have the same thing. So, and as far as other issues with the skin or the nails, do you have any like diagnosed issues?
No.
Okay. Would you flip the hands for me, please? Just looking again. Scanning, they look really good. Okay, you can go back. Do you get coolness in the hands at all?
No, not really.
Okay, so no tingling or numbness. Okay, and have you noticed any weakness in the hands lately?
No, I don't think so.
Okay. Have you ever broken any fingers or fractures or sprains of any fingers in the hand?
No.
Okay. And what about in the wrist?
Yes, I sprained my wrist.
Okay, this one here.
Yes.
Okay, and when was that?
Maybe 10 years ago.
Okay.
So a long time ago.
Yeah, still, the ligaments there can be quite sensitive. Once they've been sprained, they're more likely to get sprained again. And we want to worry about just the interaction between the wrist and the hand, and if there's compensation in the hand because of the wrist, things like that. No big deal. Okay. I will take a look with my light. We're going to start with the surface of the skin. So first, taking a general look, I do see what looks like a scar right there. Is that something you know what happened there?
No, I'm not sure.
Okay.
Maybe a cat or something.
It does look like it could be a cat scratch. That's very, very distinct possibility based on the pattern. And just running my light down each finger. Focus on the nail beds a little later. A couple of small freckles, really not a problem. Look at this side. Again, just noting a couple of freckles. You're pretty fair skin, that's typical. Okay. Have you flip the hands over for me, please, and just relax. The inside of the hands look really good. The palms are nice and appropriately colored. Okay. So you can go back to the front now. I'm going to sanitize my hands before I place them on you. It's lavender, so it shouldn't be too smelly. Sometimes the other smells can be a little overwhelming. Okay, I'm just going to start by feeling for temperature, consistency. So comparing side to side, pretty even, a little bit more coolness on the outside, but it's to be expected. One here. Okay, and palms are nice and warm, which is great. So sometimes we can feel the coolness in the extremity, especially this room is kind of cold, but I think the circulation is good. I'm going to be looking closer at the nails. So you did mention to me over email that you had acrylic nails on. So there are, I can see some remnants from that. So we do want to just be careful with that. It can cause weakness in the nails itself. Try not to do it too often and let them heal now, but they look okay. So it's just slight pitting in the nails, and some of these nails, you're in your late 20s?
Late 20s.
Okay. That's gonna start happening with age, basically. If it seems like suddenly the nails are really like getting deformed, that's an issue, but that's not what I'm seeing here. Just a smidge of dryness around the cuticles. We can give you a little cuticle oil before you leave. I'm going to guess that that's pretty much because of the acrylics. Okay. I'm going to be palpating a couple of big muscle groups here. So you've got this big one on your thumb, can get really tight. Does that feel tender at all?
Just a little bit.
Okay. Especially for people who are holding their phone. Are you right-handed or left-handed?
Right-handed.
Okay, so that one might be a little bit more tender if that's how you're holding your phone. Let me know if anything hurts, feeling for swelling in all the joints. That one's definitely a little tighter. It's like a rock. Okay. But no shooting pains, right?
No.
Okay, just sort of soreness. Okay, keeping your hands here, I'm going to move the joints. Don't move the movements, I'm going to make them. So I'm not feeling any crepitus, popping, clicking, things like that. All right, now I'm going to make you do a little work. So keeping your hands flat on the table, I'm going to have you lift up just this pinky finger. Okay, and without my assistance, just the pinky finger. Good. And now that finger. Okay, and without my assistance. Good. And now that one. Good. And this one up, please. Okay, so you are a little bit double jointed, got a little bit of extra flexibility. So you see like a typical finger, I'm holding that up. It's not really like shooting up from the joint, whereas it does a little bit. A little bit. I mean, I wouldn't say you're massively double jointed, but you have like a good amount of flexibility. Okay, and the thumb on the side. Very good. Good. And without the middle one. Yeah, okay, that one. And that one. Very good. Okay, I want you to scrunch them up nice and tight and open up nice and wide. Now with just this hand, flipping it over, I want you to go like this a bunch of times. And I'm going to hold the wrist. Okay, and now we'll open it. Good, and we're seeing nice refill there. Same thing here, open and close. And relax. Very good. Okay, test some strength. So fingers up off the table. Don't let me push them in. Ooh, nice. Good thumb to pointer finger strength. Just checking side to side. Awesome. I want you to put your hands up like this and don't let me pull you. And then push me away. There you go. Do it with the wrist, so push me down. And there we go. And then just with the thumb up like this. Don't let me push it down. Don't let me push it back. Okay. I've got a little piece of paper. I'll start with just the hand. Slip it between there and close. And try and pull it away from me. Awesome. Okay, and this side, same thing. Okay. While I have this out, actually, pick a color, whatever your favorite is. Okay. And I would like you to draw a circle, and you're right-handed, so it'll be your right hand. And then with your left hand, draw a circle. It's going to be worse. It's okay. Honestly, not bad. Not bad. Okay. I'm going to create a little maze here. And I want you to use this hand, tracing it from this point to that point. Very good. It's not going to be perfect. Mm-hmm. That's great. Now I'm going to draw a few points. And I want you to connect them like that, okay? We're testing some neurological functioning with the hands. Awesome. 2 more tests. You're doing great. So I've got a clock here. This is 12, 3, 6, 9. And I want you to draw what it would be if it was 2:30. Awesome. Probably the last generation that can do that. Okay, and very last test, I just want you to write a sentence, any sentence. It can be as short as you would like, just. Mm-hmm. I went to start perfect, and all I was doing was watching the muscle movements of your hand and how you move it along the page. So not looking for dragging, things like dropping of fingers. Very good. So far, you're acing the test. And you picked blue, which is a great color. All right. So that tested a little bit of the muscle strength in your hand. While we're on the neuro, we're going to keep going with some sensory functioning, okay? So first thing I want to do, so I have this little cotton stick, and I'm going to be running it along the dermatomes of the hands. Keep your eyes closed and just say now when you feel me touch you.
Now. 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 Now.
Now flip the hand over.
Now. 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 Now.
Okay, I'm going to do the same thing on the other hand.
Now. 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 Now.
Okay. Does this feel the same as that?
Mm-hmm.
This feel the same there, and all the way down feels the same.
Mm-hmm.
Okay. Okay. Setting that aside. I'm going to do the same test, but with a nice soft stimuli and a nice sharp stimuli. Feel the difference?
Mm-hmm.
Say soft or sharp.
Soft. sharp, soft, soft, sharp, 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 soft, soft, sharp, sharp,
Yeah.
sharp, soft, soft, sharp, soft, sharp.
Okay. Keeping your hands faced that way. I have a really tiny little filament here. It's quite like it's like a single little plastic filament. I'm gonna show you on your face. You feel that kind of? It's not super easy to feel, but if you are very sensitive, you'll feel it. So just again, close your eyes and say now or feel it.
Now, 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 now.
All right, you got most of them, so I would say this is really light, but we like to use this for testing how much, if you have extra sensation, that's also not good, right? We don't want hyper, we don't want lack of sensation. Okay. Let's move on to testing your proprioception. So a couple of tests here. I'm going to move your finger down or up. Just tell me which direction it's going in.
Down, down, up,
Okay, I'm going to do this one over here.
down, down, down,
Very good. And I'll try this side.
up, down, up, up, down, up, down.
Very good. This is 2 points, and this is 1 point. Okay, tell me what you feel.
2, 1, 1, 1, 2, 2, 1, 2, 1, 1, 2, 2, 2, 1, 1, 2, 1.
Very good. You know what? Flip it over. There is one more sensation test I want to do. This is vibration. So, do you feel that vibration there? Tell me when it goes away.
No.
Okay. Feel that? Tell me when it goes away.
No.
Okay. You feel that? Okay, tell me when that goes away.
No.
Pretty much gone? Good.
Yeah.
Okay. So good. So this one you should have been able to feel longer, which you were. Does that feel cold?
Yeah.
What about that?
It's warm.
Okay, tell me what you feel.
Cold. Warm. 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 Cold. Cold. Cold.
Does this feel cold here? Same as here? Cold here? Same as here?
Yes.
All right. I'm going to give you a little bit of break from work. You just relax. I'm going to complete some reflexes. Just give me all your weight. Perfect. adjusting the temperature. We're going to do in the main palm, the wrist, the fingers. What I'm looking for is any major changes, but side to side with temperature. That's going to tell us if we have possibility of swelling or an infection or lack of circulation. Keeping it right on those knuckle joints. Those are where you're going to get the most inflammation and swelling. So far it looks great though. So that's the biggest difference so far. This being your dominant hand could play a role in that. As long as everything else looks normal, then I'm not too worried. I want you to touch your fingers all together as fast as you can. Can you do a nice big clap? Okay, and flip them on the table. As fast as you can. There you go, dancing. Okay, I want to give you, close your eyes, a few things to hold, and there are kind of patterns on these. And I want you to just tell me, go ahead and play with that, what sort of pattern is on them. So you want to move your fingers around them, feel for the pattern and the direction of them.
Yeah, it's like striped.
Mm-hmm.
Yeah.
Mm-hmm. Exactly. Okay, and then on the other hand, I'm going to give you this one.
It's like circles, like oval.
Yep, exactly. Keep your eyes closed. I'm going to give you something else to hold. Just tell me what that feels like.
A pen.
Mm-hmm. Very good. And what about this?
Brush.
Mm-hmm. Okay. Okay. Eyes open. Good. I'm going to measure side to side for any asymmetry. This will also help us check swelling in the future. And we'll be almost done. Very good, nice and symmetrical. I'm going to go across the palm. Perfect. And just around the middle joint on these fingers. Again, that's where we get most of our swelling. Five, 6, just looking at centimeters, 6, slight swelling on that joint, 6, okay, so I'm just going to watch the right side, thumb and middle. Make myself a little bit of that. First, third finger, 1 centimeter swelling. So especially being right-handed dominant, we use it a lot. You're getting a lot of function out of the hand. We just want to make sure that we keep an eye on that, make sure it's not getting worse. All right, let's put a little bit of cuticle oil on just to create some moisture air that's gonna hopefully like soak in and give you some relief for the dryness, and then I think that'll be it for the day. Anything. Just let this dry before you wash your hands or anything like that. How's it feel?
Good.
Good. Okay. Well, that completes our examination and treatment of the hands today, Claudia. I'm so glad to have seen you in here today, established you as a patient, and we can probably go ahead and do 2 years for the next check because everything looks healthy and good.
Thank you so much.
Thank you.